Alright guys, so this is a case of neurofibroma. So we'll be discussing that what is neurofibroma. So this neurofibromatosis are tumors which grow in the nervous system. So what is neurofibroma? These arise from the Schwann cells and there is mutation of the NF1 gene. This actually codes the protein neurofibromin. Now coming to the NF1 gene, where is the location here? This is very much asked in the NEET, PGs and next questions. So NF1 gene is located on the chromosome 17 and NF2 gene is located on the chromosome 22. So remember that this neurofibromin gene, this actually regulates the cell growth, the nerve cell growth, and mutation causes neurofibroma. And also we need to remember that this neurofibromatosis, this is the autosomal dominant type of the nervous system. Now coming to this patient is actually having plexiform neurofibroma, often form early in life or may also be present at birth. And then what happens that it starts out as a soft lump under the skin. Now these tumors will then keep growing as it grows older and older. Although the growth is usually slow, but this keeps on growing. Now coming to the clinical part here, this is actually like a bag of worms under the skin. So whenever we examine, we find out like this, and this plexiform neurofibromas, these will cause severe pain, mobility problems, then vision and hearing loss, high blood pressure, and of course, if suppose there will be any kind of compression, then this will cause all these symptoms. And now coming to the treatment part here, the only effective treatment for plexiform neurofibromas are surgeries. So surgeries are being performed if suppose there is any compression of the vital organs. So here we perform the surgery and also for cosmetic purposes too. Now coming to the next type is the cutaneous neurofibromas, which are also called as the discrete or dermal neurofibromas. So these are actually these are multiple in numbers. So these tumors grow from small nerves in the skin and just under the skin, and these appears as a small bumps. We can see here in this patient that small bumps are typically beginning at the time of puberty. We can see that there are many small bumps here, and these are actually painless. So we have to keep monitoring this, and this occurs around the abdomen, torso, around the hands also we see all these discrete neurofibromas. So this neurofibromas are to be monitored usually. We have to see that whether this is compressing any of the blood vessels or any nerves which can lead to neuropathy or any kind of compression or something. So here this was about neurofibromas. One more thing which I would like to discuss here is about the treatment part here. So the surgery here, these may be considered if the tumor is causing symptoms or for cosmetic purposes. So we can see here at the hand also we can see that there are tumors, multiple. And this was all about neurofibromas. We have discussed the plexiform and the discrete. I hope that this video was useful. Okay, thanks for watching guys.